This is the caudal or inferior glide of the sternoclavicular joint. This will help because usually the clavicle is raised on the affected side during thoracic outlet syndrome. This is necessary to restore normal end range of the arthrokinematic of the clavicle during activities. First, I'll put my thenar eminence on the length of the clavicle and push down. This is passive stretching of the scalene muscles. This increases the mobility of the first and second rib and decreases the tightness in the interscalene space. First, you will have the patient in supine, and then you will push their head to the opposite side of the thoracic outlet syndrome symptoms, and then you will hold for 5 to 10 seconds while your other hand is stabilizing their shoulder, and then you will bring them back to neutral position. This is passive stretching of the pectoral muscle. First, the therapist will put one hand on the pectoral major and pull down, and then they will put their other hand on the distal arm and pull up. This is called scapular mobilization. So first you're going to put the patient in sideline, and a good technique is to put their arm over your arm, and then put your palm into their coracoid process to push out the scapula. And the scapula has 6 motions. It has elevation, depression, retraction, protraction, upper rotation, and downward rotation. This is first rib mobilization. The first rib is usually elevated during thoracic outlet syndrome. So you take the patient and put them in supine, put head in contralateral position, take the thumb or the second MCP and place on the first rib. The first rib is lateral to C7. And last, you ask the patient to breathe in and breathe out. This is called springing the rib. First, put the patient in prone, bind the spinous process, then place the other side of one hand lateral to the spinous process, with the second hand starting at the transverse costal joint, taking up the slack, and putting pressure on each rib one by one. Mobilization is the scapular thoracic flexibility. So you would ask the patient to roll forward and then roll backwards. Okay, this is called massage of the shoulder girdle. So the shoulder girdle entails 5 muscles: trapezius, rhomboid, levator scapula, pectoralis minor, and serratus anterior. So basically you just massaging the shoulder girdle. So whichever side the thoracic outlet syndrome is on, you start at that side and you basically just massaging, making sure that you're getting all the muscles that's involved in the shoulder girdle. Then you turn onto supine, where the P minor and serratus anterior. And if he was a little bit older, you would have to find the P minor. It's usually under the pectoralis major. And you massage it. That's it.